Welcome to Celestial Medicine, the podcast where we explore advanced medical astrology and its intersection with real world health questions. I'm Aurora.
And I'm Altair. Today we go deeper into planetary rulerships of the body, key combinations that traditional practitioners watch, and then examine published cases of natal females who used testosterone as part of gender-related medical care and later reported regret or detransitioned.
Important framing first. Medical astrology is a historical system of correspondences dating back centuries. It is not evidence based modern medicine. We present it as traditional knowledge. For the clinical material, we stick strictly to published studies and documented accounts.
Let's start with the advanced map. Each zodiac sign rules a body region from head to feet. Aries, the head and brain; Taurus, the throat and thyroid; Gemini, the lungs, arms, and nervous system; Cancer, the chest, breasts, and stomach; Leo, the heart and spine; Virgo, the digestive tract; Libra, the kidneys and lower back; Scorpio, the reproductive organs and elimination; Sagittarius, the hips, liver, and thighs; Capricorn, the bones, joints, and knees; Aquarius, the circulation and ankles; Pisces, the feet and lymphatic system.
Planets add the quality of energy. The sun rules vitality, heart, and overall constitution. The moon rules fluids, blood, mind, reproductive rhythms, and the stomach. Mars rules blood, inflammation, muscles, surgery, and acute processes. Venus rules hormones, kidneys, skin, and balance. Saturn rules bones, teeth, chronic conditions, and restriction. Mercury, the nervous system, lungs, and speech. Jupiter, growth, liver, and excess. Pluto, deep regeneration and cellular transformation.
In advanced practice, we look at the sixth house for illness, daily habits, and the terrain of health, the first house for constitution, the eighth for crises, surgeries, and longevity, and the 12th for confinement and hidden conditions. Malefic combinations matter. A hard aspect between Mars and Saturn can point to inflammatory or chronic structural issues. An afflicted moon may correlate with fluid, endocrine, or mood dysregulation. Multiple indicators pointing to the same body system raise the signal.
Timing comes from transits, progressions, and in Vedic systems, the dashas. A transit of Saturn over a sensitive point in the sixth or eighth can mark a period of vulnerability. Traditional medical astrologers always insist this is correlative and must be paired with clinical observation, never used as diagnosis.
Now to the modern medical segment. Testosterone administered to natal females produces expected androgenic effects, voice deepening that is usually permanent, increased facial and body hair, clitoromegaly, redistribution of fat and muscle, potential male pattern hair loss, and effects on the reproductive tract including vaginal atrophy and impact on fertility. These are well-documented physiological changes.
A subset of people who started this treatment later stopped and expressed regret. A 2021 survey of 100 detransitioners found 69% were natal female. The most common reasons included becoming more comfortable identifying with their natal sex, concerns about medical complications, and the view that gender dysphoria was linked to trauma, mental health conditions, or difficulty accepting same sex attraction. Many reported that mental health difficulties continued or shifted after transition.
Clinic-based data show varying rates. Some older surgical series reported low formal regret. More recent audits from UK gender clinics and primary care have found higher rates of discontinuation or detransition signals, especially among those treated in adolescence or young adulthood. Average time on hormones before stopping was often a few years, and the recognition of regret could come later still.
Qualitative studies and published narratives describe recurring themes among natal females: irreversible voice change that affected singing or professional use of the voice, painful genital atrophy, mastectomy scars and loss of breast tissue, realization that transition did not resolve underlying distress, and difficulty finding clinicians knowledgeable about stopping hormones or managing residual effects. Some describe the process as an ongoing one rather than a clean reversal.
Physical sequelae frequently mentioned include permanent voice drop, secondary sex characteristic changes that do not fully reverse, reproductive tract changes, and concerns about long-term bone density, cardiovascular risk, or fertility. Abrupt cessation can produce temporary hormone withdrawal symptoms. Support for people who detransition has been reported as limited in some accounts.
From a traditional medical astrology perspective, one might note that these interventions strongly affect systems associated with the moon, Venus, Mars, and Scorpio or eight house themes. That is an observational correspondence only. It does not constitute evidence that planetary positions cause or predict gender dysphoria or treatment outcomes.
What the literature does show is that a non zero group of natal females who received testosterone later reported significant regret, that permanent physical changes occurred, and that careful differential diagnosis, psychiatric evaluation, and long term follow up remain important. Rates and experiences vary. Many individuals report benefit. The data on both satisfaction and regret continue to evolve.
In closing, advanced medical astrology offers a symbolic language for constitution vulnerability and timing that some practitioners find useful as a complementary lens. Clinical decisions about hormones require rigorous evidence informed consent and ongoing monitoring. We encourage listeners to consult qualified medical professionals for any health concerns and to approach both traditional systems and emerging medical data with clear eyes.
Thank you for listening to Celestial Medicine. This episode combined historical correspondences with published clinical findings on a sensitive contemporary topic. Stay curious, stay grounded, and we'll see you next time.